At a time our packed accident and emergency departments are at their most stretched, how can the pressures on them be alleviated? In certain areas of the country, like Hertfordshire, a fast response care team is sent out, providing urgent assistance and helping to prevent A&E from getting clogged up. Here, a community matron and an occupational therapist have been called. This 89-year-old battled sepsis 2 weeks ago, but feared he was having a relapse.
Have you had your antibiotics today? Yeah. When did you finish them now?
Last night.
Last night was your last one?
Instead of being taken to hospital, it has essentially come to him.
Yeah, you had a nasty chest infection. You were really quite poorly.
And thankfully, he doesn't need to be admitted.
This is alleviating numbers going into hospital. Many patients also prefer to be looked after in their own homes because they feel that they can turn their health around quicker in their own homes.
The winter crisis continues for the NHS, but in the week to last Sunday, just under 95% of hospital beds in England were occupied, a marginal improvement. The number of patients left waiting in an ambulance for more than 30 minutes fell by more than 4,000 to just over 12,500. In Wales, the latest data shows just 78.9% of patients in A&E were treated within 4 hours last month, well below the target of 95%. So acute are the issues there, a number of emergency hospital consultants have written to the First Minister. We feel compelled, their open letter says, to share the very serious concerns we have for the safety of our patients. Safety is currently compromised in all of our departments to an unacceptable degree.
Some of that we have planned for and anticipated. Some of it we weren't able to because of the exceptional spikes in demand. On New Year's Eve, a more than 50% increase in the number of red ambulance calls. I just don't see how you really can plan for that sort of spike in demand.
And that demand will only continue, with many weeks of winter remaining.